Hello and welcome to Live Life. I am your host, Inji Mohib, and we are at the Forbes Middle East Healthcare Leaders Summit. And today I'm joined by Dr. Nicole Sirotin, CEO of the Institute for Healthier Living. Dr. Sirotin is an award-winning physician and thought leader in precision lifestyle medicine, leading global innovation in healthy longevity. Dr. Nicole, it's so great to have you with us today.
Thank you very much for having me. I appreciate it.
So Dr. Nicole, before we dive in, if you could please briefly explain what the Institute for Healthier Living does and what makes it so unique in the world of longevity medicine.
You know, we started the Institute for Healthier Living Abu Dhabi out of really a patient's story, if I can tell it. I've been a practicing physician for 20 years, and my role in medicine as an internal medicine doctor is to help people manage their internal medicine issues, chronic disease, but also we do prevention. And my heart is really in lifestyle medicine. So how do we help people really think about nutrition, exercise, sleep, stress reduction, and their social interactions to create a better ecosystem of their health? So we have a patient who I have his permission to tell this story, and he started to see me in 2016. I was at Cleveland Clinic Abu Dhabi as a department chair in preventive medicine. Actually, at that time was still internal medicine. And then we created the Department of Preventive Medicine. Anyway, he comes in and he says, "Doctor, I don't think I need these medications." And this is not a normal visit, right? Normally people come in and they are asking for medicines or they need medications. He said, "I fixed my diet, I'm exercising, I feel great." So we did some tests to make sure, in fact, he didn't need those medicines, and he didn't. And he is still off those medications, still doing great. And over the visits, we then were able to talk about we didn't have a lot of medical things we needed to talk about because he was doing such a good job of taking care of himself. So we ended up talking about, what does Abu Dhabi need? What does the health system need? Why are we in this same cycle where we all know we have a reactive system and it's not working, and many people are not getting what they need out of health. They're not thriving.
Yeah.
So that person is now on our board, actually, and he's still part of our engine that keeps us going. And you know, I tell the story because it's one individual, but imagine if we were to be able to take even 20%, 50% of the population and help them achieve what he achieved, which was really knowledge, empowerment, understanding his own body in the sense of what will actually help him achieve these health goals, and then some perseverance and some dedication on his part around actually making a behavior change. And so imagine if we can help people through that path with technology, with AI, and with the ability to take in hundreds and thousands of data points to be able to help you understand your risk, using an AI-enabled system that helps the clinician make sense of it. And then we have a multidisciplinary team to be able to take you through the hard work of changing your lifestyle, in addition to whatever medications or surgeries or procedures that might help you. And so this is really what the Institute is at its core. We need to bring the latest science. So we have started with research. We have 5 different research projects up and running, including a randomized clinical trial that we're about to launch in the public health system here in Abu Dhabi, with the very strong support of the Department of Health. We also have a clinic where we can see patients in this manner, and we have a lab to be able to bring the technologies that exist in the world, but not here yet, that are required for us to do research in this way and take care of patients this way. So we're taking a comprehensive approach. We want to be at the edge of science, but not beyond it. We want to have the patient at the center to be able to help that human make the changes that are necessary to become healthier. And we want to bring in the technologies around both of us to be able to actually achieve that in a very modern and efficient way.
let's look at the future for a bit. So, what do you see as the most exciting opportunities or emerging trends in longevity medicine that could maybe reshape how healthcare systems and communities support healthier and longer lives?
So I mentioned earlier that I think AI is at the center of this. And I want to qualify that statement because we are the Institute for Healthier Living. We truly believe the humans have to be at the center of this. But where AI is going to radically shape us is that we can suddenly interpret and understand many more data points than we have been able to before. We can also in real time be monitoring people for signs that there might be a disturbance in their system. Even if you look at something like a Whoop, right, which is not a medical grade device. Obviously, it's used in the commercial space, but there were very interesting, let's call them observations around the time of COVID and how you could actually see signs of COVID. And I'm sure many people experience this when they're getting sick. They can see some signs on their wearables already. Something's going on even before they have symptoms. Now we want a much more sophisticated way where we pull from wearables, where we can pull from environment, understanding what kind of air pollution you might be exposed to, where depending on where you're living or where you're traveling to, looking at infections, right? How infections will affect your biology. But really, if you look at the spectrum, if this is where you present with your symptoms, we want to know back here when there are things that are changing in your body, but they haven't manifested yet into something that we would call disease. And so this process of taking AI to help understand all of the data points that we have, creating a risk prediction tool that doesn't just tell me in this moment in time, this is your risk, but actually in real time can help us understand how our biology might be changing and how we can actually have an impact on that change to say, okay, we can see that there's something happening. Should we be changing your exposure right now, or should we actually be thinking about something like your risk of heart disease in a different way? Should we be starting you on medications earlier? Can we go more aggressive with your lifestyle? Can we think about, how do we improve your VO2 max? Because that's the most important factor for you in order to show your best improvements. And so this is where the personalization will be able to come in. And to me, I think this is where AI is going to actually radically change the way we look at health, because we have to understand each of us as an individual before we can make that impact.
So understanding also the progression and how that is going to help us have more of a prevention approach. Instead of just detecting the disease and treating it, how to stop it right from the very beginning and understanding the disease itself.
Yes, and really even understanding someone's risk before there are any problems, right? We are born with risk. And as our panel discussed earlier, not just your genetic risk that you're born with, but the epigenetic risk. So what changes happen in your body as you go through life.
Definitely.
We can really look at what are proactive ways to address those. In addition to AI helping us actually change our behavior better, right? So there will be ways in which that will be useful, but AI is going to be at the center of this.
Incredible, and there's definitely so much to look forward to. Thank you so much for your insights, Dr. Nicole.
Thank you very much.